Okay, let's talk about the no-touch technique. This was the technique that we developed right off the bat, probably a week into practice, where we were watching some technicians that we hired to do our first hair restorations handle the grafts, and we immediately knew as plastic surgeons who are really delicate with the tissues we work with that things weren't going the way we wanted. And the basic principle is this with no-touch technique is don't touch the graft unless you absolutely have to. This graft is delicate, it has a hair, has a couple of cells that are going to lead to new hairs, it has oil glands, it has tissues around it. Every time you touch that graft, you're crushing it. That crush can lead to a kink, it can close off the oil gland, or it can kill the follicle itself. So don't touch the graft. So we led to something called a no-touch technique, and we went through the process of how to do this procedure with touching the graft as least as possible. The biggest point was during extraction. Because if you think about when you're extracting, you usually just have a core that follows the hair shaft down, and the blade doesn't actually cut the bottom. So when you're trying to pull the graft out, it's like you're plucking a hair. And we all know that when you pluck a hair, that hair grows back. And that's because that follicle's inside. And that hair you pulled out, it's not growing multiple hairs. It has no stem cells to it. If you're trying to pull a graft out and you didn't dissociate the bottom of the graft and you're tugging on it and you're putting tension on it, it means that hair is probably not going to grow once it comes out. What you need to do is a no-touch technique. Pour out that graft, flick out the bottom of the graft using a special tool or technique such that the hair naturally falls out, or you can use suction to pull it out. And afterwards, don't touch the graft during the procedure. You absolutely need to. As soon as the hair comes out of the body, it needs to go into a cooling chamber. It needs to be evaluated there. And it doesn't have to be picked up during that process. It needs to be swiped to the side. And the only other time the graft needs to be touched is when it's reinserted in the body. And it needs to be touched with people who have delicate, experienced hands and know how to take this graft, put it directly back into the scalp without crushing it. That's the no-touch technique. It means don't touch the graft when you absolutely need to have to. Every time you touch the graft, you have a chance of damaging it. Just don't do it. So that's a simple addition to FUE that started from the beginning, and it's a very important technique to lead to more natural results.